Greetings of the day. Welcome to Physio Classroom. In last lecture, we have discussed the production principles of interferential current, and today we will continue with application part of the interferential currents. Objectives of today's session are: first, the principle of application of interferential currents, the different modes in interferential currents, the physiological and therapeutic effects of interferential currents, indications, contraindications, precautions, the placement of electrodes, the methods of application, frequency selections, dangers associated, and finally we'll see the references. So as we already know that this interferential currents was first introduced by Hans Nemec of Vienna in 1950s. Okay, so here they were using two alternating medium frequency currents, which are slightly out of phase and produced an amplitude modulated low frequency currents. So here the range of medium frequency is 1 kilohertz to 100 kilohertz. And for therapeutic purpose, we generally use the 4000 hertz and the 2000 hertz. So coming to the application part, there are mainly three methods of application. The first one is static interference, which uses 4 electrodes, which we need 4 electrodes. Dynamic interference also requires the 4 electrodes. And wherever the area is small, we use bipolar interference by using 2 electrodes. So first, let us try to understand what is this static interference. As the name itself tells you that here the placement of electrodes in such that there is only some area which is going to be treated. So we select the static interference when we know the location of the pain. When the location of the pain is pointed, fixed, we use the static mode. Here we use 2 alternating medium frequency current like any other mode. And here the orientation of this electrodes does not change and the treatment area is well defined. So in static interference, it has the following characteristics. First one, a fixed interference pattern. So we are using the 4 electrodes, and out of these 4 electrodes, there is different modulation at different areas. As you can see, we can see that there is an unmodulated area, and at 45 degrees, there is a modulated area. So what happens is basically this pattern is maintained throughout the treatment time. Then there is a constant phase relationship as it is static interference. There is localized stimulation. Localized stimulation in the sense there is going to be an area where the treatment is going to be maximum. And uneven distribution is because there is only some area which is getting modulated, stimulated, and there is some area which is not treated. So that's why we use the static interference only when we know exact location of the pain. Then we have dynamic interference. So the dynamic interference gives us the ability to adjust and modify the parameters. So this helps us to better target the area to be treated. And especially when we don't have a defined area of treatment. That means when you have a diffused pain, all my low back has the pain. So in that time, we can use this dynamic interference. Here we have generally 45 degrees and 90 degrees interference. So what happens is here there is a moving area to and fro manner, so that there is either 45 or 90 degrees, which is again a machine based one. Some machines have this option and some do not have option, which makes 50 to 100% of modulation. And here we can do several modulations. First, the most commonly used is the frequency modulation. This frequency modulation enables us or gives us the ability to use go into different depths, stimulate different fibers of the nerve, and get different therapeutic effects by using the different frequencies. Then the third one is bipolar interference. In this bipolar interference, the interference happens within the machine. That means you get a pre-modulated interferential current, which is given to the electrodes, which passes to the electrodes, and these electrodes are placed on the patient's tissue, which deliver the more like TENS like current. But only thing is, in TENS we have a fixed frequency, whereas here we have the sweep and base set, and the frequency ranges between the base to sweep. That's the only difference between TENS and bipolar IFT. Now, let's talk about the physiological effects. So basically, this physiological depends on the 4 factors. So the first factor is the magnitude of the current, the intensity of the current. Second one, the modes which we use, either we are using rhythmic or constant. Then the range of frequency we have selected. Finally, the most important one, that is the placement of the electrodes. If our placement of electrodes is perfect, then the therapeutic effects will be maximum. Then coming to the physiological effects, we have first and the foremost physiological effects for which IFT is mostly used is the pain relief. Then to less extent, we use for muscle stimulation to increase the local blood supply and the reduction of edema. And first, let us try to understand how the pain relief. The pain relief occurs by one, the stimulation of the reticular formation by using a frequency of 10 to 25 hertz. This is very similar to the acupuncture mode TENS. And second, by blocking the C fibers transmission, where you are using a 50 hertz or more frequency, which again is like a conventional mode TENS. Then we have muscle stimulation. So here, the patients who cannot actually do the voluntary contractions, IFT can be given to activate the muscles. And here for the motor nerve stimulation, the frequency used 10 to 25 hertz. But only thing is, this is a medium frequency current. This can push the muscle into the point of fatigue. So we don't use a continuous mode of interferential. Instead, we use a surged mode to overcome this fatigue point. Now, we need to understand when we are using interferential current for the muscle stimulation, we are using a frequency of 4000 hertz. 4000 hertz means in a millisecond, there are 4 pulses. So if you remember the electrical activity of the nerve, the electrical activity in a nerve lasts for 2 milliseconds. In a 2 milliseconds, when you use a medium frequency current, the medium frequency produces a pulses of 8 pulses. You can say 8 pulses in 2 seconds. That means there are some pulses which are going to be in absolute refractory period, which will not respond which will not produce any muscle contraction. Then there are 4 there are 4 pulses which fall into the relative refractory period, which if are of sufficient intensity may produce contraction. So what we need to understand is we do not get a continuous or rhythmic contractions. We get an asynchronous or irregular contractions when we use interferential current. Now, the next physiological effect is the blood flow. So here for this blood flow, most studies have demonstrated that a 10 to 25 hertz of frequency is beneficial to improve the blood flow. So the blood flow can be achieved, improved blood flow can be achieved by first one, the suction electrodes itself, they improve the circulation, the local circulation. Second one, by muscle stimulation. The third one, the deep tissue penetration by parasympathetic nerve fibers. So through all these 3, the blood flow to the area is improved. The next physiological effect is edema. In edema, the muscle contraction, which is combined with vascular changes, encourages the reabsorption of the tissue. Thereby, there is one more additional effect of suction electrodes. Then there is effect on the autonomic nervous system. So when you apply an IFT current, which is targeting the small and poorly myelinated autonomic nervous system, so this can be achieved by low frequencies of IFT. So when you use the low frequency, that is less than 50 hertz, generally what happens is you see this increase of blood flow, and this also can be used to treat the urinary incontinence. Coming to the therapeutic effects, the first therapeutic effect, as we discussed earlier also, the relief of pain. So this is best achieved by 80 to 140 hertz. So which is very similar to that of the high conventional mode TENS. Okay, the mechanism by which the pain relief is achieved is by the stimulation of the A beta fibers. So when A beta fibers are stimulated, as we already know that they they inhibit the impulse transmission of the A delta and C fibers, and C fibers and A delta fibers are the ones which carry this dull aching pain. So this can be used for both acute and chronic pain, but the only thing is the relief will be temporary. Next, coming to the other therapeutic effects, we have different frequency to relieve the pain. We can use the low frequency, that is 2 to 30 hertz, which stimulate the A delta fibers, but this can only block the C fiber transmission. And this mechanism works by activating the descending pain suppressant system and release of enkephalins and endorphins. So when we use this method of pain relief, the pain relief lasts for few hours. This can be used mostly in chronic pain. So next therapeutic effect is the reduction of the edema. For this, we can use a range of frequency of 0 to 100 hertz, which stimulates the autonomic nervous system to produce vasodilation and increase circulation. Next, for motor stimulation, we use two different frequencies, 0 to 25 hertz for the twitch type of muscle contraction, and we can use 25 to 100 to produce proper tetanic type of muscle contraction. So these two can be used to treat incontinence, muscle weakness, which are generally secondary to trauma or injury or surgery. Interferential current is commonly used for pain relief, muscle spasm, promote tissue healing, relief from edema, re-education of the deep-seated muscles. This can be also used in facial neuritis, musculoskeletal pain, gynecological problems like incontinence, the delayed onset muscle soreness, edema, post-surgical pain, bone healing, venous insufficiency, delayed union, pseudarthrosis, pseudex atrophy, muscle re-education. But this is specifically used in pelvic floor muscle re-education. Then the important thing is we need to rule out all the contraindications, and only then we can give the treatment. So the contraindications are the following. First one is cardiac pacemaker. Since IFT uses a medium frequency current, they definitely interfere with the cardiac pacemaker when applied in the chest, in and around the chest. In advanced cardiac disease, the IFT will impose extra load which may not be advisable. Similarly, hypertension, thrombosis, hemorrhage, pregnancy. In pregnancy, only the first trimester is contraindicated, whereas the third trimester, it is not a contraindication. Second and third trimester, it can be used. Neoplasm, tuberculosis, fever, all the infective conditions in and around the eyes, skin disorders, and the epiphyseal region in the growing children. So coming to the precautions, in electrotherapy department, IFT should always be placed at least 6 meters away from the shortwave dithermy, as shortwave dithermy can interfere the normal functioning of the interferential currents. Next, the metal implants in the treatment area may distort the flow of the current, which may be actually the metal implants causes the concentration of the current, which can cause the burn. But only thing is they generally don't produce burn because the intensity of the current which we use is less than 50 milliamperes, and any current more than 50 milliampere is capable of producing a tissue damage. So most of them consider that this is allowed. I mean, they say the metal implants can be, in metal implants, IFT can be used. Cancer. In any malignancy, it is not recommended to use any type of stimulating current, and IFT is not an exception. Coming to epilepsy, I mean, the stimulating current may trigger the seizure. That's why it is not advisable to use in epilepsy, or it may be used with the consultation of the treating doctor. And thrombosis, IFT can definitely worsen the thrombosis. Coming to the placement of electrodes, we use a different placement in which we have the crisscross method and the linear method, which I'll be showing you in the next. So we use different types of electrodes, the plate electrodes, vacuum electrodes, combined electrodes, quadrupolar or bipolar, vector, static. We have constant and variable with constant and variable frequencies. So coming to the placement, the most common area is very close to the painful area and on the spinal nerve roots. So these are the two common principles which we follow. So suppose if the pain is located in the low back, okay? So here the pain can be acute, which may be localized to one side. So what we do is we use the 4-pole method, the 4-pole of the quadripolar method, which we call, where we place the electrodes diagonally. So one channel is in diagonal and another channel is in the other diagonal. So what happens is there will be interference in the middle, and that is the area where the pain is situated. Then in chronic pain also we use the same, but only thing is that we change the parameters for the chronic pain. And if the painful area is on the both sides of the low back, we spread out the electrodes to larger area so that the pain is in the center. Then when we have a radiating pain, we have several options of placement of electrodes. The first option is a linear placement. So where we are going to place alternately channel 1 first electrode, then channel 2nd first electrode, then first channel second electrode, then the second channel second electrode. This is the placement. Then the other placement is 4 electrodes. So we see that we use 4 electrodes in such a way that they cross each other in between. This is another placement, but this is very less used one, but this will be effective. Then a localized low back pain, you can use a linear method where you place alternately the electrodes. And this is the suction apparatus we use along with the interferential current. So this suction apparatus which has the moistured sponges inside will hold the electrodes and provide an additional effect of the interferential current. So this is one of the common method of application of electrode placement using the suction apparatus. We can use in combination with the other modalities like ultrasound. So where one electrode of the interferential current is connected to the ultrasound machine. Ultrasound machine has an input for the combination therapy, and now the head of the transducer will act as the electrode which you have connected to the ultrasound machine. So these are some of the examples for the placement of electrodes. You can see that for the thigh pain, you can apply this, or this could be, we could modify this placement to stimulate the muscle also. This is for the back pain. And very similarly here you can see for the knee osteoarthritis, we can place the 4 electrodes which cross each other in a diagonal manner, channel 1 and channel 2. And we can use IFT at multiple locations when they have multiple pain sites. Now coming to the frequency selection, we have 4,000 Hertz and 2000 Hertz. So 4,000 is mainly used for the pain relief, and 2000 or 2 kilohertz is used for the stimulation of muscles. Now coming to the frequency selections, broadly we have 100 Hertz for pain relief, 50 to 60 Hertz for the muscle contraction, 1 to 50 Hertz for the improved circulation, and we have 1 to 4 Hertz for beta endorphin, that is descending pain to produce the descending pain suppression system pain relief, and 40 to 100 Hertz for enkephalin and serotonin. Now, like any other modality, we have few dangers associated with interferential currents. The first one is if you apply unusually high intensity of current, they can produce burns. Since the skin offers less resistance to the interferential current, there is always a risk of burn. The faulty equipment can produce a shock like any other equipment, and electric shock, which is of high intensity current, can actually can produce up and down slowly. So we need to increase and decrease the intensity very slowly. There could be a generalized malaise, nausea, vomiting. Some patients experience, very few patients experience with this. And there are few neurological effects which happen with the application of interferential therapy. So we have different types of interferential modalities. The first one, which I'm showing on the left top, is a programmed one, which have programs for different conditions, and it can be, you can select the program and the parameters. Then we have this combination unit, which has laser, ultrasound, and interferential therapy. And this is the suction unit. Then we have a portable interferential unit. And there is, you can see a patient receiving the interferential therapy for the hand. So these are my references. Yeah, thank you for attending this lecture. If you have any suggestions, queries, you can mail me at the following mail ID. Thank you very much.